Senate Republicans are trying to revive the momentum to overhaul the Affordable Care Act with the Graham-Cassidy proposal. Here's a rundown of the plan, and the rush to pass it. Jenny Stars / The Washington Post. The latest Republican proposal for curtailing the Affordable Care Act was assembled with such haste that it may get a vote before a full cost estimate is finished. But it is not a new idea. At its core, the bill introduced by Senator Bill Cassidy, R-Law, and Senator Lindsey Graham, RSC, would implement a decades-old conservative concept, capping the amount that taxpayers spend on Medicaid and giving states full control over the program. As he sold the legislation to conservative governors and activists, Graham has described it as a possible triumph for federalism, and a way to end the progressive dream of universal health care managed from Washington. "Let's get back to the basics of being conservative," Graham said in a Saturday interview with Breitbart News. "We take the money that we would spend on Obamacare in Washington, and we block granted it to the states." What's new, thanks to the Affordable Care Act, is a discrepancy in state-by-state funding that would be flattened out by the block grants. Most states used the ACA's funding to expand Medicaid. Some Republican-run states, liberated by the Supreme Court's decision to make the funding optional, did not. As a result, 14 of the 15 states that would stand to gain from block grants are run by Republicans. Democratic megastates including California, New York and Massachusetts would lose billions of dollars, a feature both Graham and Cassidy have talked up to conservatives. "We will either have to kick hundreds of thousands of people off of health care, or we will have to dramatically increase taxes," said Senator Chris Murphy, Democrat Connecticut, in one of a string of Monday night floor speeches by Democrats. "No longer will 4 blue states get 40% of the money," said Graham to Breitbart. "A state like Mississippi, they get a 900% increase. South Carolina gets 300%. Graham, elected in 1994's Republican Revolution to his first term in the House, was present for Capitol Hill's first serious block grant campaign. In 1995, in one of many attempts to devolve power from Washington, congressional Republicans teamed up with governors to both cap Medicaid spending and chop up the program's funding in Medi grants, for each state to apply to their own designs. The proposal died after President Bill Clinton, using one of the pens Lyndon Johnson used to enact Medicaid, vetoed it, denouncing the wrong-headed cuts favored by Republicans. "The president has to realize that Lyndon Johnson's Great Society has failed," said Newt Gingrich, then the House Speaker. The block grant concept remained in conservative thought, and re-emerged in 2010, when Representative Paul D. Ryan, Republican Wisconsin, then a ranking member of the House's Tax Writing Committee, included the idea in a flashy roadmap for America's future. In 2011, newly elected Governor Scott Walker, Republican Wisconsin, joined a delegation of conservatives in Washington to testify for the wisdom of devolving Medicaid to states. "It's the biggest challenge out there," Walker said of state Medicaid spending. "We have maintenance efforts that require us to maintain things by the federal government when we have other things that would work better to manage those costs." Barack Obama's own veto plan made the block grant dream futile. This year, Ryan included the idea in the American Health Care Act, the House's vehicle for repealing and replacing the ACA. Medicaid, sending it back to the states, capping its growth rate. "We've been dreaming of this since I've been around, since you and I were drinking at a keg," Ryan told National Review editor Rich Lowry in March. "We're on the cusp of doing something we've long believed in." In the 1990s, and recently, supporters of block grants have pitched them as ways to control costs without simply kicking people off of Medicaid. The slower growth in funding, and higher obligations on states, are described as problems that could be fixed once money was liberated from the federal Leviathan. At last week's rollout of the Senate bill, former Senator Rick Santorum, Republican Pennsylvania, repeatedly cited Congress's experience with welfare reform to argue that states could succeed where Washington failed. "You ever hear a governor come to Washington and complain about not having enough money for their welfare program?" Santorum asked. "No, you don't, because we gave them flexibility." But the shrinking of the welfare rolls, which began in boom times, continued even as poverty increased. Between the 1996 passage of welfare reform and 2013, the number of families living on $2 a day or less rose by 150%, according to the National Low-Income Housing Coalition. And the constituency for Medicaid is larger, with 74 million recipients, than the 3 million plus Americans who receive temporary assistance for N.